Hello, and welcome back to Conscious Caregiving with L&L, the show where we're tackling the tough conversations. Today, we are honored to bring together a panel of experts to discuss seniors and driving. Welcome, everyone, to Conscious Caregiving with L&L. Today's topic with this panel is seniors and driving. I'm Lance, the host of All Home Care Matters, as well as the co-host of Conscious Caregiving with L&L, with my esteemed colleague, Lori LeBay, the founder of Alzheimer's Speaks, co-founder of Dementia Map, and the author of Betty the Bald Chicken. Thank you all so much for being with us today. I would like to start by having each of you take a moment and introduce yourself to our audience. Michael?
My name is Michael Allenbergin. I'm a person who's been living with dementia, and I'm an international dementia advocate.
Thank you. Cheryl?
Hi, my name is Cheryl Salo, and I am the state coordinator for the AARP Driver Safety program, and we teach We Need to Talk seminars helping folks make decisions about continuing to drive.
Thank you. Dr. Lamb?
Hi, everybody. Thanks for having me today. I'm Brittany Lamb. I'm an emergency medicine physician, and online I help dementia families navigate medical decision making. I'm excited to be here.
Thank you. Ron Devers?
Good afternoon. My name is Ron Devers. I'm with PSI Insurance Agency in Lansing, Michigan, and I've been an insurance agent since 1989 and hope to bring some insurance light to this topic.
Thank you. Undersheriff Jaafar?
Hello again. Thank you for having me. Mike Jaafar, Wayne County Sheriff's Office in Detroit, Michigan.
Thank you. Ann?
Hello, my name is Ann Clark. I'm an occupational therapist and a licensed driving instructor specializing in working with adults with dementia and mild cognitive impairment regarding is it safe to continue driving or is it time to retire? I've been doing this for the last 40 years.
Thank you. Lori, would you like to start?
Sure. We are really excited to cover this topic because it is a hot topic in pretty much every household. Somebody knows a senior who's driving, and those questions come up. So again, thank you all for participating. Cheryl, I want to start with you. You know, you work with AARP in their driver safety. And the first question I want to ask is, you know, why did they start this section? I would imagine there was a lot of interest.
Thank you, Lori. Yes, there has been a lot of interest, and when we teach this as part of our classes, in-person classes, there's a lot of interaction, particularly from folks who are working or trying to help their parents make decisions about driving. So that along with discussion of in the unit in the classes, we also offer in-person seminars, and where we can go further into depth. Of course, these seminars are called We Need to Talk. And then we also do an online seminar that, and this again is at no charge, so that folks can go out to the website and spend an hour just learning a little bit more about how to approach folks and how to have conversations and how to help them make decisions.
So there's both in person and online, is that correct?
Yes, there is. Yes.
Okay. Well, that is wonderful because this is such a tough topic, which I'm sure everyone here has experienced in one level or not in terms of how you approach that. And as far as the links and stuff to get to that, we'll pop those all up on the screen so people will be able to see those. Now, you also work with something called CarFit. And CarFit, I think, is something that a lot of people might not be knowledgeable in. I know it was fairly new to me in the last couple of years. Can you explain what the heck CarFit is?
CarFit is a free event for folks who want to learn how to fit in their vehicles more safely and more comfortably. And in fact, we did an event yesterday that we helped 18 drivers. We have trained technicians who take them through a checklist, measuring the distance between their breastbone and their steering wheel to make sure they're far enough away, making sure they can reach their pedals. We check to see that their mirrors are adjusted correctly. And then we also go a little step further and check to see if there are lights and turn signals. And then the last step in the process is that they visit with an occupational therapist or a driver specialist. And yesterday we had an OT who she didn't have to show a lot of the helpers to folks going through, but she had some good suggestions. And when people had questions, of course, that our technicians couldn't answer. So overall, they're very successful events, and people are always happy that they attend them because they learn something about themselves. And, you know, some people are sitting too low in a seat so they can barely see over their dashboards. We get them adjusted properly for that. And again, our host was very pleased, and all of our technicians did a really fine job. And we'll be doing more events around the metro area in Minneapolis and St. Paul yet this season.
Well, and I find, you know, in my experience, there's a lot of times, especially with our elders, where the man always used to be the driver and the woman didn't. And then all of a sudden, if there's a health issue or he's passed away, now they're getting their license. And so it's like a whole new world for them. And I would think that would take the edge off a lot of just knowing that they're holding the wheel properly, they're the right distance, and they're not struggling. Now, if I remember correctly, you said like with the occupational therapist, if they're having difficulty, because sometimes people have difficulty with mobility, maybe getting their legs in the car and things like that there are assisted paraphernalia that they can purchase to be able to help them, or things to sit on or prop them up. Is that correct?
Yeah, you know, we have a gearbox with things like leg lifters. You know, it looks like a dog collar and leash, and you put your foot into the collar part, and then you lift your leg into the vehicle, which is very helpful. We have handy bars that can give you some little leverage that the OTs will demonstrate to people. You know, sometimes vehicles are lower, and as we age, of course, it gets a little more difficult to get out of the vehicle. So having a handy bar that you can put a little pressure on and help you raise up can make a big difference. And then we have a few other things as well, and I'm sure Ann, as an OT, can probably even speak to more things that they would offer.
Okay. Now with these, I want to go back to the conversations, you know, about we need to talk. Who comes to those? Are those the seniors themselves? Are those family or friends, or is it a little bit of everyone?
It usually is probably the children of someone who they're concerned about their driving. They've recognized some things in their parents' driving habits that they're concerned about. They've maybe tried to have initial conversations, but they don't really know how to approach that parent and who might be the right sibling to have the initial discussions. It always takes more than one discussion. It's not a one and done. You know, you just don't go to mom and say, Mom, you're a nuisance on the roads and we're taking away your keys. And, you know, it just, because, you know, all of us, driving was a rite of passage for all of us. So, you know, there's so many things that we all have to keep in mind when we are working with folks, that, you know, how can we approach them to make them think that it's their idea to maybe stop driving, and offer them alternative forms of transportation and various things like that.
Wonderful. Do you ever get like families that aren't in agreement with, let's say, kids and the spouse, and they're not all on the same page of what's going on with the particular person?
I think for the most part, what we've had in our classes specifically is, you know, the siblings, the family members are in agreement that, gosh, you know, we're seeing dad, you know, we've gone out, we've driven with dad or ridden with dad, and we've seen some of his driving habits change, and not for the better. And for the most part, I think the siblings and family members are in agreement that, you know, it's really time to have a conversation with dad and get things going, because as I already mentioned, it's not a one and done. It's, you know, it takes time, and you have to try to make it the driver's decision. You know, obviously there are further measures that can be taken, and, you know, certainly having them do a formal assessment might be helpful. because sometimes hearing things from a family member, but if they hear it from an outside party, it engages them in a different way. And just by having a formal assessment, it doesn't necessarily mean that they're going to be told they must stop driving. But there might be other options, maybe to limit how far they drive, or to not drive at night, various things like that. Only suggestions, because we're not authorized to take anybody's license away in Minnesota. The state of Minnesota is the only party that can do that.
Okay. One last question for you. Do you find people are coming before there's an accident or a major issue, and they're just seeing, maybe some things that aren't safe, but they haven't?
Yeah, I think that's a lot of it. Although I have had people in my classes who have specifically said, my dad or my mom, they've had a couple of fender benders, and they're still thinking to themselves and saying to their family, "I'm a good driver." I mean, I have a personal friend who I drove with once, and I'll never drive with her again, because I just saw the things that she did. And I don't have contact information for her daughters to even have that conversation with the daughters to say, maybe you should be observing your mom and her driving habits.
Okay. Well, thank you so much. That was really, really helpful. Lance, I'm going to throw it back over to you.
Thank you, Lori. Undersheriff Jaafar, thank you so much for taking your time to be with us today. You're here in our home county of Wayne County, Michigan, which is a very large county, encompasses Detroit and the suburbs, a good portion of the suburbs anyhow. You've probably seen a lot of situations that involve seniors in driving. I want to start off by asking, what are some of the most common issues that the Sheriff's Department comes across when it comes to seniors?
So, I'd like to start off by giving some facts and stats for the folks that are not aware of the numbers. Approximately 18% of Michigan drivers are over the age of 65. That's a big number. That comes out to about a little over 1.7 million drivers are senior citizens at the age of 65. And this is as of 2021. So that whole baby boomer generation now, becoming seniors is a major part of the population in the state of Michigan. The things that we need to be aware of with seniors, just like Cheryl was talking about, it's really common sense type observations. I have a neighbor that's elderly. He lost his wife a year ago, and I noticed that his mood, he's not the same person. He's 82 years old now, still driving, but I'm keeping an eye on him, and I've noticed that some of his day-to-day operation has definitely slowed down and is absolutely not the same. With distracted driving, it doesn't matter what age you are, no discrimination, whether you're a senior, whether you're 18, whether you're 25. I'm sure that gentleman from the insurance agency is going to love this topic of discussion, because it's becoming a major problem. As of June 30th, distracted driving is absolutely a violation, which in my opinion is one of the best civil infractions. I don't write tickets, but I had my captain at Road Patrol set aside a book of tickets for me, because everywhere I go, somebody's distracted driving. If I'm on the freeway, if I'm at a red light, if I'm in a parking lot, somebody is on their phone, and this is a major issue. We talk about drunk driving being an issue. Well, distracted driving is just as bad. It's become a major nuisance, and I commend the state of Michigan for implementing what they have implemented at the civil infraction, MCL 602B. Distracted driving does not discriminate. I've seen seniors on their phones. I've seen middle-aged folks on their phones and teenagers on their phones. So I would, suggest that individuals take that very seriously. It takes a split second for you to go haywire and into another direction. And that's something that hopefully this law will diminish sooner than later, because it's been a major issue, specifically in this country and in the state of Michigan.
Yeah. Absolutely. Do you think with seniors, when you have maybe a traffic stop for a senior, or you notice a car going extra slow or swerving, whatever the situation may be, and it happens to be a person of senior citizen age, how do you evaluate that person's ability to continue driving that day? Meaning, how do you know it? Maybe they were, distracted and so they swerved, or they're lost, versus there's something causing that difficulty with them driving. How do you guys assess? Do you assess a senior differently than you would somebody may have a younger age?
That's a good question. When you use the word assess, it's based on every situation is different.
Sure.
So the way I would assess the situation is if, in fact, I feel that the individual behind the wheel may be distraught or may be having some medical difficulty, you would actually have a conversation with that individual and, start that dialogue. And, a lot of these officers have been doing it so long, it becomes a routine. I always say that police officers, and we have a bunch of professionals on this Zoom call here, police officers become social workers in a matter of a split second. They become doctors, whether you like it or not. I don't have a doctorate degree, but if I'm in a situation where someone needs medical treatment, we're their lifeline. They depend on us. We become a school teacher. We become a mentor. So, being a police officer is a very major responsibility. And, you get a niche to understand humanity and understand seniors on whether they're driving correctly or incorrectly, or was it a medical condition. So those are, I would say, all common sense type institutional knowledge traits, if I may. And, you examine, without really examining is, can you, their vision, the hearing, you're talking to them, are they having a hard time hearing you? Because, a senior needs to be able to hear. If someone's honking the horn at you or you're doing something wrong, hearing is a big part of the driving, procedures, correct? So there's many different factors, and it's all based on the actual situation.
Okay. And what would you recommend to the audience if they're watching or listening to this? And, we see this all the time with the families we help to serve. Sometimes the siblings are in agreement, sometimes they're not. But sometimes, invariably, they'll ask us a question: should my dad still be driving? Should my mom still be driving? My answer is, if you don't feel safe enough to get in the car with them and go for a ride, then they probably shouldn't be driving. But what are some of the things you would want to point out to the audience to be maybe pay more attention to when it comes to their loved ones and driving?
Well, first and foremost, I agree with your answer. If you're not safe in a vehicle with the driver, then I think that's a sign in itself. It's very tough, as we all know. I had aging parents. They're both deceased, and unfortunately, I have a neighbor that's family to me. It's literally part of my family, and very stubborn mentality. Very stubborn. I can do it. Type mentality, and the individual will not take help. You ask, Larry, can I help you with this? No, I'm good, Mike, but you need some help. If you need some help, I'll help you. Trying to show me that I got this. I can handle it. So I would say that if in fact you feel that your loved one, specifically a senior citizen, is having difficulty, I would have, in my opinion, I would call a zero tolerance and just do what you have to do for your loved one and take over and make sure that individual is not driving anymore. It's easier said than done, because a lot of the seniors, some of them still live alone and depend on their vehicle and depend on their grocery shopping, and depend on going to the post office. And it's not an easy task, but you need to implement a plan and figure out how you can transition on helping your loved one no longer drive, because it is a problem for individuals that are behind the wheel that, unfortunately, age plays a big factor, and you're just not the same person you were 10 years ago.
Right.
It's all common sense. That's the word I would use.
Well, and, one quick more question. We have families who they don't have the wherewithal to have that hard love, tough love conversation or just pull the keys. So they say, what do you recommend? Dr. Lamb's going to like this one. We say, well, the next time they go to their doctor, let the doctor be the bad guy. Let them hate the doctor. You kind of play good cop, bad cop. That's not always practical either. So is there an involvement with the sheriff's department or their local police where if they have a concern about their loved ones, or maybe it's a concerned neighbor and it's not even family and they're seeing Mr. Jones every morning, drive over the curb to get, his car out of the garage and he's backing into the garage door and they're like, this is just not safe. Who does that concerned person contact?
Yeah, so there is a process, through the Secretary of State in the state of Michigan, where if a police officer observes an individual that's having difficulty, the officer can refer that individual to the Secretary of State and report his findings or her findings on what they have discovered while they were in routine patrol, etc. Now, to your point, going to the doctor, I mean, that's a family. That would be my answer to families. Let the doctor give the recommendation. And, obviously a family doctor is going to give the right recommendation based on the observation they come up with.
Thank you so much for your time. Lori?
Michael, I want to go to you next. Michael has been through this process. He's living with dementia, and I've had the privilege of talking with him and others about this whole decision making of should I drive, shouldn't I drive, what's safe, what's not. So, Michael, I want to ask you, first of all, if you'll tell people if you're still driving or not right now and how long you've been living with dementia.
I am still driving, and it was probably around 2008 when I was diagnosed and actually informed not to drive.
Mm-hmm. Okay, great. I wanted to show people because people will be surprised that you've been diagnosed that long, because a lot, and I won't say most doctors, but a lot will say, you live 5 to 7 years, and my mom lived 30, with the disease. Can you share your thoughts about driving with dementia? And I know you've had conversations with others all around the world on this topic.
Sure. I think there does come a time of when a person with dementia can no longer drive. Sometimes they know it, and sometimes, unfortunately, they don't, which I've known people who cannot understand. They have a difficulty with it. But I don't think it's as clear cut as people would like to think it is, that, one day you get a diagnosis and the doctor writes dementia on your chart. That shouldn't automatically mean that you no longer can drive, because there are many people who can still drive. And in my case, when I had gone to NIH and they gave me this test on a computer, well, they didn't take into account that, hey, I do have some trouble learning. And to use a computer to do a driving test is not the same thing as doing driving in a car. Or sometimes they want you to go into a car that has all these handicap features and all these different things to do the driving test, not your own car. And that creates a bunch of misunderstanding on the part of the person with dementia, because it's something new and it takes a lot to get used to. So to me, if you want to really identify if the person could drive, the best way to do it is to take them in their vehicle that they're used to driving and allow them to go through the process and the motions and see how they drive. And again, you want to look out for little nicks and things constantly happening on the car. There are little telltale signs if there's a problem, when a person's driving, or the tires being scratched up, or the rims. So it's not clear cut. I will tell you, I am starting to consider that soon, or within the next year, I may need to stop. Not necessarily that my driving is bad. My driving is still good, and my wife will tell you that. But I'm starting to have a lot more difficulties in my mind and understanding a lot of things that are starting to cause me concern that if I'm having those kind of issues, will it bleed over to my driving? As you know, I just drove on a track not too long ago, Lamborghini on over 100 some miles an hour, 8 laps, and then the guy let me run with it, and he says, "Man, you're doing great." So that proves I'm still able to drive. I'm still good. I mean, I was involved in a serious possible accident that I avoided. That my wife said, somebody else behind the wheel, we would have been dead. We would have been dead. But I was trained by a racing car driver at one time, so it's all stuck in my head. I still have all the reactions and everything. Do I drive a little bit slower sometimes behind the wheel? Absolutely. Do I not feel as comfortable behind the wheel? Absolutely at times. But I take those precautions. You know, there's times I say, hey, I tell my wife, you drive. I just don't feel like it. My mind's not all there. So I do take precautions. Am I the same as I was reaction-wise? No. I will never say that I am at the same speed that I was. But am I as fast as a person who's old age who is still driving? Absolutely. And probably faster. So I think what we need to do when we try to decide when somebody has to get their license taken away, you have to look at a lot of things. You know, some people will say that if you get lost, you shouldn't be driving. Well, I get lost. And you know what? That's what I have GPS for. Takes me everywhere and gets me where I want to go. My sister, who never had a problem with dementia, she couldn't figure out how to go from point A to point B because she always got lost. So what do you do with somebody like that? So I think we have to take it in reality and really talk to the person and figure out. And I will tell you, I've spoken with people who thought they should be driving. I said, they should not be driving. You know, and they didn't understand that. And that comes with dementia. Some people just don't understand what they're dealing with, and they think they're perfect. They don't think there's a problem with them. So that's a whole different viewpoint. When you're dealing with somebody like that, you have to take different actions. In my case, I understand. I don't ever want to be a burden. I don't ever want to risk hurting somebody, including myself. So, I mean, I've already told my wife. In fact, I talked to an insurance agent. I said, and I tell him every time I have any little incident, and he tells me, "No, Mike, you're okay. People do this all the time." Because I've learned from, you know, some cops. They tell you if they follow you for 2-3 miles, every cop can find something wrong with your driving. You know, people think they're so great at driving, but we all screw up. You know, if you just follow somebody, you know, I mean, I never say nothing to my wife, but believe me, she doesn't drive that great, but yet she's always picking on my driving because I live with dementia. She thinks in her head that I have a problem, but that's reality.
Michael, I want to ask you, because our Dementia Chats group has discussed this, and people have different modes. Like some people have written a letter to their family saying, when I get to this point, it's okay to take my driver's license and take the keys from me and pull the car. Others have said, you know what, I'm going to do a video. And because I don't want you to feel guilty when this time comes, if all of a sudden I'm not in agreement because I'm not in the right state of mind to be able to see these differences. And the other thing that everyone kind of agreed to was what they said when they didn't feel safe carrying around their special cargo of their grandchildren was when they should stop driving. And I thought that that was really interesting. So I think there's some proactive things that people can do as they age, dementia or not. I mean, there's lots of different chronic illnesses and then just normal aging as a fact. But I think it's wise not to be afraid of this conversation. The other thing that I was really impressed that you did is you bought a new car and you said, I'm getting a new car because I want all the bells and whistles to help me drive safer. So it's going to tell me if I'm going over a line, and, you know, it's going to have the automatic brakes and some of those things too. And so I thought that was a really interesting perspective, because your mind seems to be really wide open to being able to drive as long as you can, as safely as you can, and tapping into whatever is out there to assist you. So any last minute things you want to say? Otherwise, we'll pass back to Lance and go on to the next person.
Sure. Not everybody, unfortunately, can afford to buy a new car. But in my case, the first time I delayed it years and years because I kept thinking, I'm not going to be able to drive next year. I'm not going to be able to drive. So I kept delaying it. But it just kept going on and I was still able to drive. So I said, you know what? I'm biting the bullet. I'm buying a car. Since I knew my response time was slower and I assumed that impacts my braking and everything else, I wanted features that would help me get better response time and all, and that's what you get by buying a newer car because they improve the braking, they improve all the different things and all the bells and whistles. So technology has now saved me a lot. In fact, a couple of years ago, I decided on buying another car because new technology, and all this technology helps a lot. And the good news is it's around the corner because I was in California last year. And there's cars that are driving themselves and they're picking people up and they're dropping them off and all. So it's not that far away that we're going to all be able to use technology that we don't have to physically drive. It's going to be able to drive us.
Great. Thank you, Michael. Lance, you want to go ahead?
Yeah, thank you, Lori. Ron Devers, we're going to go to you and talk about insurance because insurance obviously affects driving and a lot of different factors. When it comes to age or somebody like Michael who's been diagnosed with dementia, how does that viewed or how is that assessed from an insurance standpoint?
That's a good question. Obviously, age is a factor in determining insurance rates for anyone who's driving. If we all remember back when we got our driver's license when we were 16, 17, 18 years old, we probably heard our parents say, "I can't believe how much you're costing me, kid." And because so when they reach 25, 26, insurance rates would go down. What we're finding is when they get up to that 65-ish area for seniors, the rates start going up because there's propensity for some to have mishaps. According to the National Highway Safety Administration, 17% of all accidents in 2021 involved drivers who were 65 or older. And those were the deaths that happened, and 200,000 of those accidents had people in the hospital. So we see, the propensity toward these people being involved in accidents and those types of things. When it comes to the diagnosis side of things, age is not the sole factor. Their physical and cognitive abilities and those types of things. As someone mentioned, I think Cheryl mentioned earlier, we can't take anyone's license away. That's the state of Michigan's responsibility to do that. And with Michael's talking there, there's varying degrees of how cognitive and physical disabilities affect people. So the thing that we look at is if the Secretary of State takes action against someone's license, that's when the insurance company has to make a decision about which way they go. So it can have an effect depending on what the state of Michigan does.
Do applicants, do they have a duty to let their insurance company know that they've been diagnosed with some form of dementia?
On auto insurance, there's a whole variety of questions, as we all know, but there is nothing on there as it relates to cognitive ability and those types of things. There are questions about your claims history. Anymore with technology, insurance companies can click a button and get a whole listing of the last 10 years of claims that you or someone in your family may have experienced, from the minor windshield claims or the dings in the door to the big claims that happen. So those types of things. And then obviously they look at the driving record and see. We pulled up someone called in for some insurance help yesterday, and we pulled up their driving record, and we don't know what the situation is, but their license has been suspended for 3 years because of a medical condition. We can't write their insurance because they don't have a valid Michigan driver's license. So we're trying to help them to it's a difficult conversation to have, but we're trying to address that, find out what the situation is, and see if we can help them or help their family in that respect.
Let me piggyback on that for a minute. And when you say help them, in what sense? When their license has been suspended for 3 years, what would their insurance company be able to do to help them?
Mm-hmm. Well, in Michigan, we're a no fault state. So, if you and I, Lance, were involved in an auto accident, my insurance and my injuries and everything would be paid for by my insurance, and your damages and your injuries would be paid for from your insurance. If you don't have car insurance, if you're not named on a policy, then you don't have some of the medical coverages and those types of things, or it's very limited from the state of Michigan. So what we can do is write, it's called a named driver policy, where there's no auto affiliated with it, but the person can pick that up so that it gives them the personal injury protection so that they have medical in case they're injured in an auto accident. If they're still working, then there might be wage loss benefits and death benefits that the state of Michigan would pay to those people. So there's no auto insurance per se because there's no car because they can't drive, but we get them those all important no fault benefits of the personal injury protection and the work loss.
Okay. What happens if someone is diagnosed with dementia or something that could affect their cognitive or their reactionary abilities, and they don't tell their insurance company? You said it's not on the application. So if they receive a diagnosis or they're dealing with a diagnosis of some nature, do they have to report that? Or what if they don't report it?
Quite often we hear about it from the family members. The family members will come in or they'll call and go, "Hey, my parents, we shouldn't let them drive," but they don't want to have that conversation. On our panel, Michael, has been diagnosed with dementia and sounds like he's doing a fabulous job of driving. And, to piggyback on something he said, if getting lost was a reason to lose your license, I probably would have lost my license every day for the last 10 years. But that said, they don't have an obligation to tell, but again, it will show up if there's a restriction because of their cognitive or physical ability. It'll show up with the Secretary of State. The state of Michigan has a manual called the Michigan Guide for Aging Drivers and Families, and it's found on michigan.gov website. And it's like this thick, and it has ideas for the families to have the conversation with the aged senior citizen or those who might have dementia or other problems, help them to have that conversation. But there's also a form in there that they can send to the Secretary of State and say, because of these situations, I think my father or my mother or whoever should be re-examined for their driving ability. And then, like you said earlier, make the Secretary of State the bad guy because they're going to reach out and say, your license is renewing, but we want you to come in for a re-examination to make sure that you can still drive. That's the way they can handle it. Again, it's largely is the relationship between insurance carriers and the Secretary of State that will dictate those things. But if someone does have dementia or something and they don't tell us about it, as long as they're listed on the policy, there'd still be coverage. We had insured both elderly individuals, and he called one day, let us know that his wife had passed, so extend our condolences. But in the process of talking about her, end days, they had two vehicles, and her vehicle was parked furthest from the door to where the driver's side was against the wall of the garage. As her, cognitive skills eroded, he would leave her alone for short periods of time and, come home. Everything would seem to be normal. After she passed, he's like, I should go get her car ready to, sell, get rid of it. And when he went around the side of the car, the whole side of it was caved in because while he would step out of the house, she'd go joyriding and hit God knows what. And, he called us up and he, frantic, if my insurance isn't going to cover this, because of the relationship we have with the carriers, we explained to them in detail, what happened. Claim was covered and we fixed the car and he was able to sell it. So, a lot of times the relationship between the family, the insurance agent, the insurance carrier, we're an empathetic bunch, despite the fact we may be boring as all get out. But we really do, try to educate and help. So,
all right, thank you, Lori.
Well, I'm going to go to Anne here next. Anne, I'm really interested in your driver's assessment and who comes and how they get to you to begin with, because I've heard many people struggle with having to go or going multiple times and stuff. So who comes and who calls to make those appointments to begin with?
Typically, clients come to me through law enforcement. If someone is stopped for erratic driving and they receive a letter from the state saying they need to meet with an examiner from the state, that examiner has the ability to say they need a statement of medical fitness to continue to drive. That statement needs to come from a physician. Physicians, in turn, want a more thorough assessment than they can do in the office, so they refer the client to me. I use something that's called the driving risk calculator, and it has 21 different assessments that look at upper body, lower body strength, reaction time of the foot from the gas to the brake, a very thorough visual skills assessment, not just visual acuity, but peripheral fields, contrast sensitivity, which is our vision in low-level light situations like dusk, dawn, and night, depth perception, and the biggie is visual scanning skills, how quickly people can move their eyes, take in information, and make good decisions. So I have several computerized tools that I use to help assess visual scanning skills and visual scanning reaction time. And then the last section of assessments that I use relate to thinking skills. The overall basic cognitive assessment that we use is called the Montreal Cognitive Assessment. I also use something called the Snell-Grove Maze test, and then Trail Making A and B test. All of the assessment tools that I use have been specifically studied relative to the task of driving, meaning that people took the tests and then they went out on the road and correlating their scores in the clinic to how they performed on the road. Based on the outcome of those 21 tests, if someone we rank the scores on a low, moderate, or high risk potential for involvement in a motor vehicle accident, again, based on the studies that have been done for each of those tests. If someone has 4 or more moderate risks or 1 high risk score, a behind the wheel assessment is recommended. Because in addition to being an occupational therapist, I'm a licensed driving instructor. I will take people out on the road for them to actually show me how they can drive. Michael, I understand what you're saying about driving in someone's strange vehicle. But according to the laws of Minnesota, where I practice, we have to have a driver's training brake on the right side of the vehicle. And so people don't usually have that in their regular vehicle, so we use mine. And I very consciously made efforts to not have any of the adaptive equipment in the vehicle when people are testing that have cognitive impairment. And by adaptive equipment, I mean hand controls or left foot accelerator or alternative steering devices. I remove those when I'm doing assessments with people with cognitive impairment to give them the most normal driving experience that we can. And based on performance on the road, we'll make a recommendation whether they should continue to drive, whether they should drive with restrictions, and we can restrict based on speed limit of the roads that they travel, such as no freeway driving, or no driving on highways of speeds greater than 65 miles per hour. I also can make recommendations, no nighttime driving or driving within a radius from home, say 10 miles. Or 20 miles, depending upon the situation. That will allow people to continue to drive, getting to their church, their grocery store, out for coffee, and still be able to drive in that limited, restricted fashion. So basically, that's the process. I make my recommendations then back to the physician that referred, and the physician is the one that would need to make the recommendation to the state whether the individual can continue to drive or not.
Okay. Well, it sure is a detailed process. You're looking at a lot of things. I know I had a friend who was going to take the test. I've known several people who have taken the test, and some have failed, and then they keep going back, even though it's a costly process. It's not cheap to have these assessments because this is a cost of the individual, if I'm not mistaken. Is that correct, Anne?
Well, in my practice, the clinical skills assessment is covered by Medicare because I'm an occupational therapist and it's billed as an outpatient occupational therapy assessment. Behind the wheel assessment is not covered by any form of insurance, and that there is a cost for that assessment out
Okay.
of pocket to the client.
Okay, that's what I thought, because I remember my friend, she could get a car or a minivan was the two choices that she had, and there was a cost difference between the two of those. When these appointments happen, I would imagine the person's got to be feeling some stress when they're there and kind of high level anxiety. How do you deal with that, or do you try to calm their nerves, or just let them go through the process however?
I would say that I'm pretty conscious of when people are experiencing test anxiety or just general anxiety going through this process, and often we'll stop and say, we need to take a break. We need to do some deep breathing. Would you like a cup of coffee? Would you like a glass of water? The clinical skills assessment can take 2 hours. And I purposely have it scheduled, blocked off on my schedule for 2 hours, allowing time for those breaks because I know people can struggle to do test after test after test. And sometimes if people get so anxious, I say, I think we're going to stop where we are today and let's, go home and we'll make a second appointment. Oftentimes coming back for that second appointment, they've met me, they know where to find me, they're less anxious, we're able to continue with the testing. If someone has experienced a condition that causes them to have communication disabilities like aphasia, or say someone who has not done well in school, that reading and writing and those sorts of skills were not something that they embraced or were very good at, I will take that into consideration with especially the cognitive testing, because a lot of them are really paper pencil based, and those folks I will give the benefit of the doubt and recommend behind the wheel. If someone is doing very poorly on the clinical skills assessment and they show no insight to their deficits and just are letting me know that even with restrictions, they would not be following those restrictions, I will recommend driving retirement without taking them out on the road. There is no magic air in a car that makes someone be able to compensate for some of the severe deficits that I've encountered in my practice.
Okay. And then how long does the behind the wheel test take? And I suppose it depends on how they're doing, if you cut it short or not.
Yeah, typically it takes an hour because I want people to experience, we start in a parking lot, helping them get a large parking lot, get used to operating the vehicle. Then we'll go to low traffic residential area, move up to a little higher speed rural traffic, moving into commercial traffic, and then we'll do the freeway last if they're doing okay. I also modify assessments based on the desired driving radius of an individual. If they never drive the freeway and aren't going to, then we won't drive the freeway. If people never drive downtown, we won't drive downtown. I try to modify based on individual need, and so timing of the assessment can vary.
Okay. And where do people find providers? Is it best just to start with their doctor and go from there and be referred out to an occupational therapist, or?
Yes, in order to be seen by an occupational therapist, an individual would need a referral from a physician. So that would be the best place. If the doctor doesn't know about, if if the occupational therapist has a driving assessment potential, an individual could contact ADED. That's so it's ADED, the Association of Driver Rehabilitation Specialists, and the website is www.aded.net. And you can look for a provider. And I just went online and checked in the state of Michigan. There are 13 certified driver rehabilitation specialists like me, and they're in 9 different communities in Michigan. None of them are in the UP. And I suspect that's why I'm seeing folks in Duluth from the UP. But there are several certified driver rehabilitation specialists in Michigan.
Okay, great. Thank you. Lance, we'll throw it back to you.
Thank you, Lori. Dr. Lamb, how are you today?
Hi, I'm great. How are you?
We're saving the best for last.
Oh, no, that's not true.
As you're sitting here, though, listening to all the professionals and, giving their perspectives from their professions, you probably see all of this kind of culminate inside of the emergency room in some form or another. Share with us what some of the downstreaming effects you have witnessed in the emergency room when there are people driving who maybe should not be driving.
Oh, yeah. I mean, it's too late when you come to me, that's the kind of big takeaway I would say. Obviously I see accidents ranging from minor accidents all the way to very serious accidents. And people who are aging are oftentimes on blood thinners, which can make car accidents much more dangerous when they sustain injuries. I think that there's also the isolation that happens when people don't drive. And so I love what everyone has said about how this is it's an individualized process. So people need to be assessed as individuals as to what their abilities are to determine whether or not they're safe to drive. And I think that the most important thing is really hooking up people in their communities with what resources they have available to be assessed. And I think, having these open, frank conversations about what might potentially happen and the dangers, hopefully will get people talking about this and being willing to approach physicians to go and get an occupational therapist order to get assessed and all that. So, but when you come to me in the ER, it's kind of too late.
Well, and I just want to kind of stay with that for a moment. When they get to, like you said, it is almost too late, if not definitely too late. How is it, though, that it gets to that point? So, these people who are driving, who maybe shouldn't be driving, they're most likely, especially our seniors, they're seeing their primary carers or their cardiologists or whoever it may be. At some point, I almost feel like, just from this outside perspective, that they're slipping through the cracks and they're not getting evaluated before they reach you, when there should be a way they should get evaluated. Is that right or is that wrong?
No, I agree with you. I think that kind of touches on a lot of the issues and inefficiencies that we have within the healthcare system. I mean, you get 15 minutes typically with physicians unless you pay a concierge physician. And, people don't always look at the big picture. And I mean, someone's functional abilities and their cognitive abilities are very important to assess when it comes to driving. And it's a personal and public safety issue. I agree with you. I think that I'm not a primary care doctor. So, I think that part of the assessment as people are aging should be talking about driving. I think it should be normalized as part of the evaluation, but that's not my area of expertise and my area of practice. When I see people in the emergency department, sometimes I do talk to them about it. But it's a very emotional place to be, and you have to kind of pick your battles when you're in the ER, what you're going to focus on that day. Sometimes people are open to talking about these things and other times they aren't. But I think you're right. I think that, cardiologists, specialists, primary care, you're going to all these different people. Everybody has their own skin in the game, the boxes that they need to check and their organ system and the things that they're responsible for. And I hope that there are primary care doctors out there who incorporate this as part of their regular kind of checkup. annually.
Right. Well, and that leads to the question, and I think the answer is no, but is there an evaluation that physicians do which addresses these driving issues?
I mean, I think that like what Mike was saying about common sense, you know, and again, this is not what I do for a living, but if I'm a primary care doctor and I have a patient come into me who's obviously having difficulty walking, difficulty communicating, issues with hearing, vision, cognitive issues, my mind is going to go to their safety. And so I think the topic probably is broached by good primary care physicians and working with families, you know, but there's not any, we rely on occupational therapists because we are not trained in these functional assessments. We do not have the time to do them. And like what Anne was talking about, like that's what people need. They need that detailed level. We kind of screen them, like the risk is high, the risk is concerning. And then we say, okay, you need a formal evaluation.
Right. How about what would you and other physicians recommend when you see there are concerns about elders or seniors driving and their abilities? What is the most effective recommendation?
And I think that there's no one size fits all. I think it's looking at the person as an individual and then figuring out what you have access to for that person in their community. And I think starting with approaching the physician about, I'm concerned, we have concerns, I want to get an evaluation. I think that asking for a formal referral for an evaluation is what I would do. That's what I would recommend. And then, you know, the area agency on aging may know, like the local area agency on aging may know different companies that can do evaluations. And then I love what Anne, I didn't know about this website. You said ADED, so I just looked it up. So, you know, looking at that website, I think would be good. I don't think there are enough evaluators, in overall. So I think that's an issue. When someone has lack of insight into their disease process, there's actually a medical term for that. It's anosognosia. I have a hard time saying it, but people can lack insight into the fact that they actually have a problem. And in those instances, you might actually just have to take away their access to the vehicle. So take away their car keys, get rid of their car, get it out of their visual sight, get it out of their environment. And it's not going to be a nice process, but sometimes that is what is necessary to keep people safe.
Absolutely. Well, I know, you know, when we consult with families, and just recently we met with a family and their mom was still driving. She had more advanced stages of dementia. It was very evident. And they were talking about, well, on Tuesdays and Thursdays, she goes to the VFW or the Elks or the Moose or whatever lodges. And we said, well, how is she getting? Well, she's driving herself because it's only 2 blocks away. And we talked to the daughters and said, you may really want to consider her not driving anymore because, you know, we're having these concerns, or at least get her evaluated. Okay. We went back 2 weeks later. Mom had just had a horrific accident, drove her car into a telephone pole and sideswiped another car. But it took that incident for the daughters to finally agree there's an issue with mom driving. You know, sometimes it's like almost one or the other. The family is almost in their own denial. And I think part of that, I'm sorry, some of it plays into their own selfishness, because if mom's not driving, that just means we're going to have to pick her up and take her more places now. So, you know, they're trying to hold on to that as long as possible, but they're not looking at the big picture of their mother's safety and the safety of other people on the road. And it just seems like there's a big gap in the system where these people who, you know, all intentions are good, but they really have no business driving. So I know you're not a primary care doctor. If you had a patient, Dr. Lamb, and they came into the emergency room and they're not there because of an accident or anything auto related, but they drove themselves there, and, you know, maybe, you know, they're having some cognitive issues, or, you know, their gait's off or their reactions off, whatever the situation is. Do you ever have a flag go up about, does driving ever cross your mind, or because it's not really your area, it's not really front and center?
That's a really good question. I mean, maybe it will be more so now, honestly. I have to tell you that if people come in, I'm oftentimes seeing them in the bed. I don't always make them get up and walk. It depends on what they're there for, you know? So, I will say that I get worried about people who have low blood pressure, low heart rate. You know, the medications that people take can cause some pretty significant side effects and can contribute to difficulties driving. But no, I honestly, like, in being completely honest, when they come in through the front door, unless there's something that has happened in that evaluation that's made me go, oh, you drove here, you know, and I'm sure I've had episodes like that where I'm like, you shouldn't be driving, but you know, I've been doing this for about 10 years now. We can't take away people's driver's licenses, and I don't report people. I tell their families, like, you know, I'm concerned your person's living with dementia. I'm concerned that there may be an issue here. You need to be evaluated. I've done that. But no, I mean, when they come in after accidents, usually the police are involved, and then that's kind of how the ball can get rolling on potentially removing their license.
And I want to just got two more quick questions for you. If you have a patient and they come in because of an accident, the patient has dementia, but the patient was not at fault in the accident, and maybe the police wasn't aware that the individual had dementia, maybe it wasn't quite evident to you, but after the fact you find out that that person has dementia, does that change your perception or your plan of treatment in any way? Do you think that plays any bias into it?
When people are living with dementia, depending on how progressed their symptoms are, you know, honestly, it can be very easy to miss that in the emergency department. And I'll tell you that when it is more obvious, we do more testing, because when you realize you can't rely on someone's history that they're giving you, then you wind up doing more tests because you can't rely on what they're telling you. So, you know, you can do a physical exam on someone and you can look at their vital signs and look at their past medical history. But in general, I mean, we tend to err on the side of more testing when we can't rely on history. So I guess in a way, yes, it biases us. Does that answer your question?
That answers it, yeah. And just the last question, and I know we've kind of all touched on this, but what does happen when the person with dementia refuses to give up their keys?
Yeah, so what you talked about sometimes happens and it's the same thing with when we try to get people help and evaluations for cognitive impairment. You know, a lot of people are resistant to this, and there's lots of reasons for that. You know, there's a lot of emotion and stress and fear that comes with being labeled and having a diagnosis of a disease that's causing dementia. And the same thing with losing that independence with driving. It is a big deal. It financially, and then also mentally, like, to lose your license, it's your loss of independence. It's a huge deal and shouldn't be taken lightly. But in some instances, I mean, people just need to have their keys taken away and the car needs to be removed. And it's an individualized decision. You know, it has to be done for the person as an individual.
Okay. Thank you so much. Lori?
Yeah.
Well, this has just been a fascinating conversation. And I mean, I have like 20 questions written down, but I want to let our panel react to other people's comments. And so I thought, Cheryl, I'm going to start with you first. What are your thoughts with everything you're hearing? I'm sure there's something you want to add.
Well, the first thing I would like to do is ask Dr. Lamb a question. Because Dr. Lamb, you mentioned blood thinners, and as part of our instruction for our driver safety classes, we talk about medications and how they affect our driving as we get older. Could you speak a little bit more specifically about the how blood thinners may affect cognitive impairment, or if it does or doesn't?
Sure. So blood thinners will not affect your cognitive impairment. They increase your risk of bleeding. Right. So if you're in a car accident that's significant and you're on a blood thinner, you're more likely to have a bleeding issue. And most commonly we see brain injuries with hemorrhage, and then internal like chest bleeding in the chest or bleeding in the abdomen. It's obviously way more complicated than that. But yeah, blood thinners. So there's Plavix is like an antiplatelet medication. Aspirin falls in line with that. But then traditional blood thinners are going to be like Coumadin, Xarelto, Eliquis, those medications. The medications that could affect your cognitive abilities would be, so if your blood pressure is low, you have decreased blood flow to your brain, it could affect your ability to react, your ability to have judgment. So having low blood pressure, having an extremely low heart rate because of a medical emergency that's caused you to have an accident, or just because you're over medicated, or there's, when people are living with dementia, specifically Parkinson's related dementia, Lewy body dementia, there's a condition called, well, basically their blood pressure and heart rate can fluctuate. It's called autonomic dysfunction. That's more common with those folks. And that can put them at higher risk of having, decreased blood pressure and feeling like they're going to pass out. Okay. So that's kind of what I was getting at there. And would be another person to kind of weigh in on this as well. I see she has her hand up.
I would imagine dehydration runs into that too, because a lot of seniors have problems with dehydration. Go ahead, Anne. I'm sorry.
Regarding medications, I do a very thorough medication review with the patients that I work with. And especially looking at any use of pain medications, benzodiazepines, because they can significantly affect level of alertness and cognitive processing, visual processing, reaction time. Those are big, big red flags for me. And like I said, if there's a red flag, then I recommend a behind the wheel assessment to see actual performance. I wanted to respond to something that a question that had been asked of Dr. Lamb. What do you do if someone doesn't stop driving? In my area, we had a program called Dementia Friendly Duluth, and that program involved bank presidents, law enforcement officers, nurses, doctors, the Chamber of Commerce, people, managers from restaurants, people from many different walks of life in one room talking about what we do to make Duluth a friendlier place for people with dementia. And what that did for me was strongly connect me to law enforcement, so that if I'll get a call from a physician's office, so-and-so drove here and we know his license has been suspended. And I say, okay, I've got it. I call my connection in the, St. Louis County, if it's a sheriff, or the chief in the city of Duluth, and I provide name, address, as much information as I can, indicate that the license has been canceled, revoked. I also double check with the state that it has been revoked. What happens then is law enforcement will look for that individual, and if they're driving, pull them over. The vehicle's left at the side of the road, and they're driven home, and the family is told they need to come and get the vehicle. It only happens once like that, and people get the message.
Well, that's good. Thank you very much on that. Cheryl, I wanted to ask you one thing, because I know AARP, not only do you have the CarFit and the, we need to talk, but there was mention of where do you go for classes and stuff, but they also have a 55 plus, which is just kind of a refresher course on driving as well, and as many others do, and people can get a discount on that as well. So you guys have a really nice resource there as well. I just wanted to mention on that.
Yeah. So it's mandated in Minnesota that drivers who take a driver safety course, they're often called defensive driving or 55 Alive, but AARP calls it driver safety, that they get 10% off on their car insurance. I'm not sure what it is in Michigan. Some states have a mandated statute, other states don't, but it certainly does help to keep drivers safer on the road.
Yeah, and it's nice because
once they turn 55, they just learn It's not that they've necessarily learned new things, but they're refreshed on things. They're refreshed on what laws have changed and so on going into effect. We talk as the sheriff spoke about the distracted driving. That law has been on the books in Minnesota since 2018. People did a pretty good job the first couple of years, but then after COVID, we're back to way too many distracted drivers on the roads for whatever reasons. So, and I do want to mention, the Hartford puts out some really good publications if you're not aware of them. At this point, they do one that's called At the Crossroads, and it's family conversations about Alzheimer's disease, dementia, and driving. And then they also do one that's called We Need to Talk, family conversations with older drivers. And you can go out to their website and download that. And we as AARP instructors can order the manuals and booklets ourselves to share in our classes. So, I think the Hartford's a really good resource.
And we will have those in the show notes for people to be able to link out to. Lance, I'm going to go back to you.
Yeah, Ron, you had your hand up?
Yeah, to Cheryl's point, in the state of Michigan, if someone does take a defensive driving course or, one of those types of things, like she said, it's not necessarily to make them lose their license, but just to help them refresh on the laws and, how to drive properly. So there are discounts built into many of the insurance carriers in the state of Michigan as it relates to those types of courses.
Great. I wanted to go back to Undersheriff Jaafar real briefly. Listening in to the other panelists, do you have anything you'd like to add or any comments?
Well, first and foremost, I'd like to thank everyone that participated because it was a very educational session for myself also. And there was a lot of great ideas. And this is what I encourage in my day-to-day operation. Teamwork makes dream work. We're a lot stronger together. And I thank everyone for that. I just would like to add that, take the laws seriously, specifically this most recent distracted driving in the state of Michigan. I know Cheryl said it's been on the books since 2018 in Minnesota. Kudos to them. I really believe that if individuals take that distracted driving and follow the rules of the law, the rules in the books, life would be a lot easier in driving around the state of Michigan. Distracted driving is a major, major issue. I can't emphasize enough about how much of a concern it is for me as an administrator and law enforcement. Distracted driving has got to stop.
Yeah, I just want to add real quick, and I think Lori's going to jump in here in a second. It seems like, Michael had talked about getting the newer cars with all the bells and whistles and, the more safety features, but I feel like they also add a lot more distracting features as well, at least in my opinion. I mean, you have these giant screens now in a lot of the vehicles with all the little buttons and apps and different things that you can mess with. And it almost seems like it's counterintuitive in some ways. I don't know if anyone else would agree with that. I know, like my kids, they want me to turn around. Dad, look at this. I'm like, we're driving down the highway. I cannot turn around and look at you. But they're young, so I'll forgive them for that. But I agree with the Undersheriff. There is just so many things that distract you. And Dr. Lamb, if you want to add into this in a second, I remember in college in one of my physiology or biology classes, we're engaging our senses in like super overdrive when we're in a vehicle. We're engaging every sense and then some, and we just can't overstimulate ourselves or distract ourselves in this sense to that degree and still feel like we're being as safe as possible.
Yeah, I don't have anything to add. That's very well said. I mean, it's judgment, it's reasoning, it's insight, it's situational awareness. Like you have to be paying attention in order to do those things.
Right. Lori?
Undersheriff Mike, I wanted to ask you a question because I hear this from families a lot. Families will say, I'm going to call the police. They're in the car. I want them to follow them. Maybe they'll pull them over. Do you guys get calls like that? I hear families say that all the time. They try pulling the batteries or hiding the keys, but then they're like, we're just going to call the police and say they're in this car, they're heading this direction, and what can you do about something like that?
Yeah, so that's true. From my standpoint, with my agency, we're a secondary law enforcement agency, which means the majority of the folks or municipalities in my county have their own police department. So when you call 911 in Wayne County, it's not coming to the Wayne County Regional Dispatch, it's going to your local, and then we're like the backup. But to your point, yeah, that is the case. From my experience, I've had instances where that's happened, where individuals have called the police in reference to what you just mentioned.
Okay, great. I want to go up to Ann and then over to Cheryl because I see your hands are raised. Ann?
I wanted to respond to Undersheriff Jaafar's comment about the grouping of people here. I'm very involved in the Towards Zero Deaths program in the state of Minnesota, and that gets road engineers, law enforcement, EMTs, driver educators, and everyone else is the other E in the same room talking about the same concerns and what can we do to reduce deaths in the state of Minnesota. And Michigan also has this same program, and that's the chance for us to all collectively talk and be creative and successful in how to make the road safer, whether it's conflict resolution interchanges, or if it's adding contrast sensitivity to testing at when people come in to test for their licenses. There's a number of different things that are in the pipeline in the state of Minnesota, and I encourage in the state of Michigan folks to be involved in that process because it's really really effective to make changes.
Are one of the things that they're looking at is alternatives? Because I think there's so much resistance to giving up our driver's license. I mean, I don't like to get an oil change because I'm like, what if I have to go somewhere, in that 20 minutes they're doing my oil change? And to think of not being able to have my license and go freely about, is that a conversation that comes into play with making our roads safer?
Well, it certainly is. We one of the really amazing things that's going on right now, all the organizations that have received funds through the state of Minnesota to say purchase vans or purchase transportation vehicles are in one pool and looking at how can we utilize those motor vehicles effectively. So, for example, I'll say UDAC, which is an organization that is a developmental achievement center, and they use their vans to pick up their workers in the morning and drive them at home. But the vans sit in the parking lot during the day. Well, let's use those vans to help seniors get to doctor appointments or seniors get to the grocery store. This is better utilization of things that we already have out there. That's one of the big outcomes of this group.
Okay, great. Thank you.
Cheryl, I see you have your hand up.
Yes, I too am involved with Towards Zero Death in Minnesota, and last fall we trained 13 Towards Zero Death participants at their state meeting to be CarFit instructors. But Lance, I wanted to answer your question about safety features on vehicles. AARP also offers a program called Smart Driver Tech. And that is can be done online. You can learn about all the safety features in the vehicles. In our classes, we speak to them, not in a great deal of depth, but refer them to SD Tech. And we have in-person events in Minnesota, 90-minute seminars, as well as online. So, and Lori, I don't think I gave you this information, but if you want to learn more about SD Tech, you can go to aarp.org/SDTEK. And they will give you some stats and facts and figures about how the safety features do help. But in the long run, the whole importance of it is we emphasize the fact that these safety features help you, but you are the driver and you are still the one that's responsible for driving safely.
Right.
So I think that can probably answer some of your questions about dealing with those issues.
Michael, I want to pull you in because I'm sure you've got some comments after hearing everybody talk on so many different levels. What comes to your mind with hearing this conversation today?
Well, I think it's important that we ourselves, who are trying to identify and help the people with dementia, don't contribute more to the problem. And what I mean by that is, like I said, in 2008, they told my wife that I should no longer drive. Well, my wife asked, well, did he fail the test? No, but there's going to be one day that he can't drive. That was 15 years ago. And that put something in my wife's head. It put something in my head. And my wife, every time I was behind the wheel or something, thought that there could be a problem. So she was overly cautious. That brought down my self-confidence to this. And I started not believing in myself anymore. And I said to myself, I said, I know I could drive, but I keep hearing all this. So I had to go out, and I took a trip all the way down to Florida from Pennsylvania. I drove for 3 weeks on my own, all the way down there and back. That built my self-confidence back up, and I felt great again. But for the longest time, I just felt that maybe I shouldn't be driving. I didn't know anymore. And that in itself could lead to a lot of problems to these people, because you got to remember, when you're living with dementia, your self-confidence is extremely low to begin with. And you add that on top of it, that creates, to me, a lot of issues. And I think we need to figure out how we still support those people. You know, I heard somebody mention issues with gait. I got to tell you, I got issues with gait at times. I walk through the door and I smack my shoulders. Does that affect my driving? Absolutely not. Dementia is a crazy disease. I will tell you. I mean, I was a high-level manager, and I still can't understand how this disease can create such havoc on the mind that people don't even realize. Like, for example, I know a friend of mine, she was standing in front of her house and she couldn't figure out where she lived. That only happened for 5 minutes in her time of 10 years. So here you had one incident that created such havoc that made this person worry, should she drive or not? She's still capable of driving, but she actually stopped on her own because of that. Now, do you think that's a good enough reason to stop if the person still can drive? I mean, people have heart attacks behind the wheel. So it's not black and white as people would like to see it. I've heard doctors who say the reason they don't identify people with dementia is because in their state, the minute they put it down on the record, they have, instead of doing a simple A form, which is real quick, they got to go to plan B, which means they got to write something to the state and everything else. They lose their driver's license. And they say, what benefit does that cause? It only hurts the person more. So we have to figure out why we do these things and figure out how we address it. And then we'll probably get more doctors doing their job and say, yes, this person shouldn't drive at certain times. But we shouldn't make it mandatory that the minute you go from not on your record to your record, because that's just going to stop people from going to doctors, and they're afraid to talk to doctors and tell them about all the issues. So yeah, we have to rethink things, I think. You know, it's not an easy solution. And believe me, I'll be the first to tell you, because I did run into a person that I thought he should still drive because of all he told me. But the more I found out about him and everything, I realized he shouldn't drive. So I realized how difficult this is for some people to understand. And some people just don't get it. And it's not their fault. It's the dementia that's preventing them from understanding that.
Well, and I know when we did a show on this years ago, we had doctors and insurance agents totally change their mind after this full conversation. So I'm hoping people's minds will open up on terms of what this looks like, what it feels like, and how to deal with it. I would like to ask a question of all of you, and that is, how do we make this conversation more comfortable for people? And Michael, I'm going to start out quick with you on that one in just a sentence or two.
Well, I'm a firm believer of showing people what is happening to them, and because they don't always see it. So if you have videotape and then you see them making errors and things, they may not get it until you show them these things, or to keep track by writing things down. Oh, on this day, you put a dig in the car. Write it down, initial it, because they may not believe it because they just don't remember it. And I think if you start to show things to people and show it to them in a way that they themselves understand that they did these things, I think it starts to sink in for some of those folks. Now, it won't work for everybody, but I think it helps to do that rather than say, well, you're not driving well. Well, what does that really mean? You know, my wife had said that to me. I fly 90 miles an hour. Well, I always flew 90 miles an hour. Does that mean I'm not driving well? That's just the way I always drove. I was a fast driver. So, you may not like that, but that's the way I always drove. So it's nothing different for me.
Okay, thank you. Ron, do you have suggestions on how to make this an easier conversation with people? I know people struggle with even, should I tell my agent that there's a medical condition or that I'm worried about this, because they don't want to lose their license, and will it be, will they lose insurance and stuff? So how do you make the conversation about insurance and aging and driving safety easier?
Excellent question. The thing that I've taken from this conversation, one, is that senior driving, people with dementia, I mean, there's all sorts of physical ailments and cognitive things, Parkinson's, diabetes, all these different things that can affect someone in their driving. So as Dr. Lamb said, this is really an individualized situation. But the other thing I have taken from this conversation, there are so many resources I didn't even know that were out there. Cheryl talking about the AARP resources, and Ann with the state of Minnesota and the state of Michigan, and those types of resources. The state of Michigan has the Michigan Guide for Aging. We have to, as professionals who are in the forefront of this conversation, we have to educate, in my case, my customers, from the standpoint that those hairy conversations, those conversations that are difficult, are sometimes the ones we most importantly have to have. Because if we don't have that conversation and our loved one goes out, or our neighbor goes out and they have that accident that takes the life of a small child, of a family, whoever it may be, then we waited too long. I would rather have the difficult conversation and have someone angry at me and save a life than to not have it and roll the dice and see what happens, So, from that standpoint, from an insurance standpoint as well, there's bodily injury liability. If I have a cognitive situation or a physical problem that's documented, and it causes me to cause someone bodily injury or property damage, I don't know if anyone's ever been deposed for a lawsuit. Not the best time to be a person in a room with attorneys. But all your stuff is going to come up, your physical ailments, your cognitive things, and those will be, brought up to, show the liability that you have. And, those are important things to consider as well. It only takes one uninsured accident to ruin your entire family's future. Have those conversations because they're so vitally important.
Thank you. Cheryl, did you have any ideas of, again, you guys are doing a lot of nice stuff, with AARP in terms of having this conversation, but anything else you want to add?
I would just suggest start the conversations early, as soon as you're noticing any kinds of issues with driving, and pick somebody from the family who has the most positive relationship, the easiest conversationalist with the parent and so on, and have those conversations often so that the driver has the opportunity to noodle it around for a while, to think about and before taking any actions.
Okay. Brittany?
Yeah, so I agree with you all. I think that it's better to think about this in advance and think about it more, just think about it more as it's going to happen, that it's highly likely that at some point we will all lose the ability to drive, and trying to plan for that for yourself as a person and for the people that you care about. So what do you have available to you when the time comes that you need an evaluation? How can you get one? Who do you need to talk to? Does the person need to move? Does the person need hired help? Like, what can we do to kind of think about these things ahead of time? This is the emergency department has taught me, there's a lot of holes in a lot of the things that we do in the system, and thinking about and anticipating the future can help us plug a lot of those holes in advance. So I think this is just one of those situations.
Right. Undersheriff Jaafar?
I agree with everyone. Everyone had great ideas. Ron hit the nail on the head when he talks about his customers. As a police agency, we look at the citizens as our customers, and it's our responsibility to educate and inform folks on issues that we're talking about. So collectively, as a group, I think this is a type of stuff that or type of forums that gets people's attention. And this is how we move forward and getting this rectified.
Okay. One question I just thought of for you too was, and we've done this with our dementia-friendly group, and I don't think and Anne had mentioned a dementia-friendly group in Duluth, and I don't think it has to be through that, but even through the cities, to have town hall meetings on seniors and driving and pull a panel together and get that conversation locally, so you have the city on board. When we've done stuff like that, we've had a really good turnout, because people are wondering, who do I call? What is the process, with all of this stuff? And I know, and I didn't know this until one of our groups, but they said you can call 911 if you have somebody with a health concern, and they can make those notes in the in the non-responsive 911 call. They'll pull it over, but they'll make notes that if Joe has a dementia, or maybe he has heart issues, or maybe he's epileptic, maybe you're concerned about driving, where he goes, nicknames, all of those types of things, emergency contacts and things. Is that something you guys utilize there? I hadn't heard of it all over the place, but I thought it was interesting.
Yeah, so we actually have a youth and a senior organization that's a nonprofit with the Wayne County Sheriff's. It's called the Wayne County Sheriff's Youth and Senior Fund. And what we do is we educate seniors on various topics across the county. And we have it's like a lanyard with a wallet with their emergency contact information on there, and it lists all their medications and so forth. And we have a cell phone program where if they need a cell phone, they're able to get one, so they can contact 911 if they don't have any other capabilities of doing so. So we do have some type of programs, but the town hall is definitely something that is needed, and it would work for a lot of the seniors that can't get out. So I just don't know, and you may be able to answer this, Lori and Lance, as far as the Zoom capability of a lot of these seniors. I'm not sure what it is, but if that is a scenario where the sheriff's office here in Wayne County can assist you in doing some type of forum, we'd love to be part of it.
Sounds great. Yeah.
Wonderful. That's fantastic. And Zoom capabilities differ. There's a lot more active seniors on Zoom, especially since the pandemic, than ever before. And so people are kind of surprised at that. And I wanted to see if you had anything you wanted to add about how to have a comfortable conversation on this topic.
Well, the first thing is when we recommend someone consider retiring from driving, that we have to give them a way to continue to get out into the community. And the reason why people balk at retiring from driving is because they don't know how to get where they want to go. So I always say, don't take away someone's license unless you're also giving them routes for transportation to where they need to go. The AAA did a study and said that the average American outlives their ability to drive by 7 to 10 years. That means all of us are going to need to consider retiring from driving. I live out in the country, and my husband and I are moving into town because it would just be too difficult for us to access what we need to access living way out in the country. You know, home care doesn't even come out that far. We need to make choices because we hope to live a long life and know that driving might not be part of that. So start the conversation early and anticipate that you need to provide transportation if you recommend driving retirement.
I think that's a great, great moment, because that is something that I think is so fearful.
Yeah.
And people don't like to ask for help either. They like to give it. You know, someone mentioned that earlier. I think it was Lance in one of his stories where, no, but if you need help, let me know. I'll be over there. So, family, friends, churches, social groups, hiring home care, all of those things can be options for people. But again, change is uncomfortable, and we have to make it more apparent that it's okay. It's not about losing your ability to socialize and get around. It's about increasing safety for all and comfort. And but then we have to help one another out. And we've kind of turned into communities of isolation where we're not there for our neighbors like we used to be when I was a kid. It was just a common thing. Oh, you need a ride, or you need me to run to the grocery store or go to church or whatever. I mean, that was on your mind. I mean, you thought about it. You were concerned about somebody. And nowadays, I blame it on the garage door opener. Ever since we have the garage door opener, you grab your mail, you drive in the car, the house shuts down, and you don't talk to your neighbors like you used to and stuff. So thank you all. Lance, I'll throw it back to you to close.
Yeah, I just want to say thank you to everybody for their time today, to Michael and Ann and Cheryl, Dr. Lamb, Undersheriff Jaafar, and Ron, and of course you, Lori. We just hope that today's discussion will help share this topic and raise more conversations. We're right down the street from the sheriff's office, so we would love to help do a town hall event. I think that's a fantastic idea. I know in several of our cities here in Michigan, our cities provide senior transportation, where they have a senior bus that will come and take people to doctor's appointments, to the grocery store. It's not all individualized, but it's better than nothing when you don't have any other means for transportation and it doesn't cost them anything. And then, of course, we have the PACE program as well, which I just like to see that continuing to grow and develop, because it's a wonderful resource for seniors. And again, thank you all for your time and for bringing your expertise and voice to this important conversation.
Lance, can you explain what the PACE program is? Because some of our listeners might not know.
Yeah, sure. So PACE is a state-ran program, and they do have Medicaid requirements, but it will take seniors to different locations. It'll help them with transportation. From my understanding, it's not widely available everywhere yet. There were certain, locations in the country that were using it as a test pilot program, but it's a tremendous resource. I don't know if Dr. Lamb is familiar with it. I don't know where the state you're in, but it's a wonderful thing. It's kind of like city transportation, but for these Medicaid families and recipients, and they have special resources just for seniors.
Wonderful. Well, thank you, everyone. What a great conversation. And for people listening, we would love to hear your comments and thoughts. You probably have other resources that we don't know about, so please put those in your comments, or reach out to us, or reach out to our panelists. We will have all information, like I said, in the show notes there. And we just want to help people as much as possible. And Lance and I know we can't do that alone. And we're a small panel considering all the people in the world. And that are dealing with seniors and driving, and we can all make a difference and make this easier than it has been in the past. So thank you.
Thank you for joining us today here at Conscious Caregiving with L&L. We look forward to seeing you next month.